CCAP Across the Map Quick Clip. How can cervical cancer be prevented? Early detection and regular screenings are important to cervical cancer prevention. Early detection is a key step to prevent any early cervical cell changes from becoming cancer. You should also pay attention to any signs or symptoms you may be experiencing and alert your healthcare provider immediately. Regular screening tests are optimal in reference to cervical cancer prevention and detection. Screening tests include the human papillomavirus HPV test or a pap smear test. The HPV test and the pap smear test can be performed at the same time or individually. The HPV test is conducted to look for the HPV types that are most likely to cause cervical cancer. During the pap test, your clinician will collect cells from your cervix to be examined in the lab for cancer or pre-cancer. The Centers for Disease Control and Prevention has specific guidelines to address when screening should begin. For people who are ages 21 to 29, it is recommended to start getting pap smear tests at age 21. And in the case of a normal result, this test will be repeated every 3 years. For people who are ages 30 to 65, it is recommended to discuss the best testing option with your provider. It may be recommended to continue pap smear testing alone every 3 years, to do primary HPV testing alone every 5 years in the case of a normal result, or to do co-testing, which is where the pap smear test and HPV test are done at the same time every 5 years in the case of a normal result. For people ages 65 and over, your provider may recommend discontinuing screening if the results have been normal for several years, and or you have had your cervix removed as part of a total hysterectomy for non-cancerous conditions including fibroids. It should be noted that for individuals with compromised immune systems, a history of cervical cancer or cervical precancer, or other conditions, you should consult with your healthcare team in reference to screening recommendations.